Hi, it's me, Ingrid INFP, and I'm in the laundry room. It's a new laundry room, right? Because I moved. Um, I don't know what's going on with my laundry machines because they're different settings and stuff, and I put a setting that was half hour, and it's still going, and this is like 2 hours later, so I must have done something wrong in the program of the programming of the washing machine. But it should be done soon, so I thought maybe let's just make a video while I'm waiting. This laundry room, there seems to be a problem with one of the washing machines because my towel ended up smelling like really bad. So I'm just using this one washing machine. I just keep finding more and more problems with my new place. Anyway, I still don't have Wi-Fi. So I had my meeting with my psychologist. Last time was before my move. It was like more than a month ago. It was like 6 weeks ago. So it was good to talk again. I talked about the fact that I keep thinking about the Wi-Fi. I keep thinking about my INFJ ex-friend. I keep thinking about, the same things again and again. And it irritates me. And I'm like bored of myself, you know. I want to think about other things and distract myself, but for that I usually use Wi-Fi in order to listen to music and to go, think about different topics, because I'm learning about topics, like usually it's video essays that I watch, or just listening to somebody else's voice is always nice. I know that people watch this channel because just listening to a voice is nice, so I'm glad to be that person, I guess, because I like listening to some people's voices, and it doesn't matter what they're talking about. I'm just like listening anyway. It wasn't a great therapy session, but I think that it might be my last therapy session. He's going to be calling me at the end of August to just check that I was okay, to see if my autism diagnosis process is done or if it's still going on, that kind of thing. The point is that once I get my autism diagnosis, things are supposed to be magically better, and I'm like, yeah, no. But thing is, my therapist does not know much about autism, so he's kind of at a loss of how to deal with certain things. Because I was telling him about the loops that I have, and saying and he was asking me how do these loops make you feel? How, can we change these loops into some other kind of loop that might be more helpful? And thing is, yes, I've already tried doing that myself a little bit, trying to, instead of thinking terrible things, I try to think more positive things, okay, I can't do anything about this right now, so I may as well just do something else, or and he was asking me to look at the worst case scenarios and see if I could manage it. And thing is, I don't know. I don't want to. Thinking about the worst case scenario, maybe it's good if you don't have much imagination. Okay, people who don't have much imagination, I guess that their worst case scenario might be okay, they do a presentation at work and the worst case scenario is people laugh at you. And that's not great, but you think, well, will you be able to survive it? The normal person who has an okay sense of self and an okay understanding of logic in the world would think, no, I would be able to survive it, right? It would be terrible, but I would be able to survive it. And I can think so too, but I have such creative ideas of what could happen that it does not really work out, So my idea is like, okay, what's the worst case scenario regarding the Wi-Fi? Well, it is that I don't have Wi-Fi for the whole month, or that I never really managed to couple myself to Wi-Fi because there's like a problem with my stuff, and that therefore I might need to buy a lot of new things in order for it to work, and deal with a lot more administration and deal with a lot of practical stuff that I don't want to deal with, right? And also, I'm also worried that my landlady will get mad at me for not being able to manage this on my own, and therefore entering a conflict with my landlady, and therefore, being kicked out of my building. I know that won't happen, but that possibility is there, And how do I turn this? And he's like, okay, well then, if you think about the worst case scenario and you think that you can survive it, then it's more of a positive feeling, right? And I'm like, yeah, but no, I don't feel better. This doesn't feel good either. To think that, I will be able to survive it, so therefore it's not something that I need to think about. My thoughts come in whatever I do, no matter how much I talk about them, no matter how much I try to turn them into something a little bit better. I'm glad that some of you guys in the comments said that like some obsessive tendencies can be good, like when you're pursuing your passions and you can develop a skill through that, or you can develop a lot of knowledge on a certain subject through that kind of thing. And yes, that is true. But I'm not the one who chooses what my brain decides to focus on. That's the thing. And so I try to like reconnect and be like, okay, you can't think about not yet. You can't, but there is no point to thinking about this right now. Let's think about something else, because all you can do is wait for the IT technicians to come next week. There's nothing more that you can do. My therapist wanted me to stop getting into problem fixing mode and try to just like think about it in a neutral thing that I have to let go. I have to let go of that. But it's like, I don't know if this is going to work for me. Anyway, that was the first part of it. I also told my therapist about my conflict with my boss not listening to me. And so my therapist kind of suggested that, because I said, well, I want clear communication from my boss. I want to know an answer to my question. And then my boss kind of swerves away. And before you know it, like he has the upper hand again. And he is talking about something completely different than what I was asking about. And he said, well, can't you just stay firm and say, can you please answer my question? Or like add something. But I don't have that extra bit of energy to go that far. Because if I were to, like, questioning my boss once is enough. Staying true to my point after my boss has explained and started to talk about different things, the energy has kind of gone from my body by then, Like, I'll be like, with my boss, I'll be like, what do you think about my suggestion about this certain way of organizing things? And then he'll be like, well, yeah, no, and then he'll go and like the whole economic system, and then talking about how blah, 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 that doesn't really work that way. And I'm like, okay, but will you consider my question, And I feel like I'm already getting a bit I'm being a little bit too bold, and it's a little bit scary for me to ask to be heard once again, I can ask my question to be heard once, but asking the same question again or going further on my point takes too much of my energy, and I can't do that right now. I don't have all that fight left in me to do that. But I will try to take this therapist's advice into account. So like, okay, if he hasn't listened to me the first time, maybe I should be a little bit more stubborn and do it the second time. It's just the fact that I don't like being that person who is questioning everything my boss is saying, And unfortunately, I don't think that he will listen the second time around I'm asking something. It's rather that he will get defensive and angry. Just from knowing him, just from having seen him in other interactions. So I'm not sure that will work either, but okay, I'll take that into consideration. And then I went into the fact that I need to tell my parents about me doing an ADHD and autism assessment, because I need a childhood history. So somebody from my childhood who knew me when I was a child needs to speak to the psychologist at this private ADHD autism center that is going to be doing my assessment in Stockholm. And my parents are not really understanding about mental health, I have sometimes told them like, oh, it's been quite a lot at work, or I'll be like, yeah, I'm feeling a bit sad today, or that kind of thing. But as soon as I get more than that, like I'm like saying like, oh, I'm depressed, that's the limit, It's like they're like, no, just keep going, and it's not like they start listening to me and taking my feelings into account and thinking that maybe I need some help with certain things or that kind of thing. It's rather like, you're on your own. And it's like mental illness does not exist in their minds. My cousins have children with ADHD and autism, and my mom just thinks that, oh, ADHD, everybody has that nowadays. I suspect that my mom has ADHD herself, and so she doesn't know what it's like to not have ADHD. So she thinks that this is the way that everybody is, and therefore everybody is suffering as much as she is. And so that's why it's hard for me to go out and just say, I think that I might have autism and ADHD, and that's giving me difficulties, because my mom thinks that everybody has the same difficulties she has and that I have, and that isn't ADHD, and that isn't something that should lead to mental struggle. And yeah, that's pretty depressing. And my dad never speaks anything about feelings. The most I've come to talking to him about feelings is talking about how a certain patient case has made me feel has been difficult, or talking about how there has been a lot of work to do at my workplace. If I just say even just oh, I feel sad because this bad thing happened today, my dad wouldn't really know what to respond to that, and he wouldn't say anything. I suspect that my dad is very emotionally repressed, and that he's also autistic, and that he's the kind of autistic person who does not really want to dwell on emotions because he thinks that he doesn't feel them. Not all autistics are like this. Just a few, there's a certain subset, I guess, like the ISTJ, the ISTJ autistic IT workers. My dad is very stoic. He never expresses emotions except perhaps irritation and anger. and he doesn't even really know how to express that. So me saying that I have a mental health condition is, just outside of the realm of the sort of things that he thinks about. He never mentions his mother that died, and it's been 6-7 years or something. He never mentions her by name. And it's like, so I'm not counting on him to help the psychologist. I'm counting on my mom, because my mom knows more about my emotional life, but she doesn't know anything about mental health. It's kind of ironic because my mom studied psychology in college. She ended up majoring in psychology, but then she tried to do pre-med, but didn't get in, and in the end she went into a little bit of a side of psychology, which was marketing. But she thought that everything was just silly. Basically, she thought that psychology was just for, not a hard science. She thought that it was, because she learned abnormal psychology at school, and it wasn't what interested her. She didn't want to actually help people with mental health conditions. I think that she sees herself as separate from those people, those crazy people out there who are mentally ill. And I think that she has mental health issues herself, but she's not working on them. I think that she has depression, and that she has ADHD, and I think that if she got help, she would be able to have a much better life than the one that she's leading now. But I'm not going to be saying all that. So what did my therapist say about this? Because I was like, I'm really scared of talking to my parents about it. And he's like, well, what were you going to say to them? And I'm like, I don't even know where to start. How do I even start such a conversation? My head draws a blank, should I say oh, I've not been feeling too well lately? Or actually, I've been feeling terrible for my whole adult life? Should I say that I'm having difficulties at work? Because that's not really the truth, right? I'm doing quite well actually right now. I'm doing quite okay at work, but there are certain things that make me different from other people in terms of home life and work and relationships and stuff. And also, I'm not currently depressed right now. I've stopped taking my antidepressants, and I feel quite good, actually. But yeah, 2 seconds. I'm going to just check what's going on with the washing machine, because it's confusing me a lot. Okay, I don't understand that washing machine. What should have taken 6 minutes has taken 18 minutes. So anyway, so I was like, I don't even know where to start, because coming out as gay, there are often certain ways to get it into the conversation, or I haven't even come out to my parents as gay. But usually when it comes to other people, I will wait until they have said something, and then I will say, well, actually, and I will kind of turn it into a joke, and that way I can come out. But it's not like I just go up to a person and say, I'm gay, or I don't start a conversation with that fact. It's more like somebody will start talking about certain thing relating to being straight, or, having relationships with opposite sex, or People will start talking about like becoming pregnant or having children. People will talk about these general boring things, and they will be like, "Oh, what do you think, Ingrid?" And then I'll be like, "Well, actually, I'm gay," and that's usually how it goes. The one time I did come out as gay to a lot of people at once was at my workplace last year, and I basically like made a big deal about it. I was like, and the way I got into it was, I've seen lots of you guys at Pride, and I'm really thankful to have colleagues who think that this is important, and that's why I have brought some a pride flag and such, and also I'm going to like take this opportunity to come out as gay, and I got a good response. But that was like planned thing, and that was the only time I did that kind of thing. But when it comes to mental illness, where do you start? How do you start talking about it after not talking about it for 10 years with my parents? Since I moved to Sweden, I don't have regular contact with my parents. And now I might be seeing them. And every time I go to France, every summer, every winter, I think, should I come out this time? And then it's never the right time. And every time I think, I need to talk about my mental health. And then it's never the right time. Because these are serious things. And it's more serious because it's my parents. Also, mental health is a pretty sad thing, as opposed to being gay, which is a pretty positive thing for the person who is gay, like you're celebrating something. While mental illness is not something that you really celebrate. It's more like awareness. You have like Autism Awareness Day, ADHD Awareness Day. But it's not like Pride, like Autism Pride Day. That would be fun, but it's not the sort of thing it's a deficit, it's a condition, it's a disorder, and it's not easy to talk to people who aren't really in this entire realm. So my therapist recommended that maybe I should just tell them, oh, I've read this book that is about autism, maybe you should read it, and not mention that I am relating to it. Thing is, I don't think that my parents would want to read such a book anyway. But that was a good thought, to maybe get the people a little bit more knowledge about the subject before I start talking about it concerning myself. So yeah, I don't know what I'm going to be doing with all this information, but it is good to think this through with somebody who maybe does not understand my situation, but understands, has experience of other people going through similar situations. And so have a great day, everybody. Bye.